Hey, hello everyone, and welcome back to another episode of the Tokyo Living podcast. Our guest today is another wonderful member of the Club 360 team, one of our newer members, so much so that when I do see him without his mask on, I'm thinking, who is that guy? Oisin Mcpartlin, welcome to the show, mate.
Thanks, man.
So perhaps if you can start just by giving listeners a bit of background on yourself, academically and professionally, what you've been up to, and what brought you to Japan.
Well, obviously born in Ireland, studied in Ireland, studied athletic training in Carlow IT, which nobody will know other than an Irish person. And then, just been traveling around after that. Lived for maybe a year and a half in England, lived for a year and a half in Dubai, and then moved here. I suppose the main reason we moved here is because my girlfriend is half Japanese and she wanted to experience living here, and I didn't really have any preference of where to go, so I was happy enough to come to Japan and experience it, I suppose. Spent the first year teaching English after school, which was not fun. Lots of kids that didn't speak very good English and just wanted to play around, which at 4 or 5 years old is understandable.
Pretty normal. Yeah.
So, happy to get started back into what I really wanted to do, which was, personal training and injury rehab, I suppose. So, the opportunity presented itself. So I was pretty happy to get started here.
Yeah, and we're certainly happy to have you on the team. And then now you've reached the absolute pinnacle in your career and found yourself on the Tokyo Living podcast. So congratulations.
The way your career goes now, podcasting is the way to go.
That's it. Most people jump straight from Sam Gilbert to Joe Rogan. It's sort of a career progression. So you got that to look forward to. So we've got you on the show today to discuss mainly sort of exercise as a preventative measure for disease, and in particular respiratory disease and SARS-CoV-2. And I think this is a really important area and topic. I believe that I think there's already been a sort of greater focus on health and wellness throughout the pandemic. And I do think this is going to be even greater once we sort of come towards the end of the pandemic. I think that people are going to view health and fitness in a different light than we did before. But I thought would be good to sort of just go into the science behind this a bit. And I know you've done quite a bit of reading in this space, and so I thought it'd be good to get you on and pick your brains. So maybe if we just sort of start by talking about SARS-CoV-2 and the symptoms, and perhaps even sort of the mortality rates, and how different other disease states and predisposing factors affect that symptomology and mortality.
So I mean, I think in the Western world, exercise started becoming fashionable. I know when I lived in London during 2012 Olympics, after that it really kicked off. Everyone was seeming to want to start exercising. It was getting a better name for itself, but less likely to be, I don't want to put on weight, I don't want to put on muscle kind of thing, and more like, okay, this is a healthy lifestyle. I can look good if I'm exercising kind of thing. In Japan, I don't think that's really got to that level yet, especially in the female population. I think there's still that fear of getting bulky, getting big, looking like a bodybuilder, which is very hard to do.
I know it's a funny thing that some guys that will spend their whole life trying to get big and trying extremely hard. It's almost insulting when people think that they're just going to look at a weight and suddenly pack on muscle. But I think you're completely right there.
Yeah, wishful thinking. But So I think exercise, especially here, needs to be promoted a lot more. And I think we've seen now with the pandemic that exercise has been shown to be very, very good way of preventing these diseases, or even just preventing the more serious symptoms of the viral infections, especially respiratory illnesses. So I suppose there's a few risk factors that I'm going to go through. This is not going to be all of them, but some of the main ones that we can really have a good effect with by exercising and by being healthier and just getting into that routine of having a good exercise, weekly exercise routine, and just getting into a healthy habit and healthy lifestyle.
Yeah.
But I mean, the first one, and probably the one that was coming out with most research early on, was obesity. And they're basically, most of the research was saying that BMI over 25 was people were experiencing a lot more severe symptoms. There was a study that came out to say 79% of COVID patients that were admitted to critical care had a BMI over 25. And you compare that to people with a BMI under 18.5, and that was only accounting for 0.6%. So obviously there's a massive, massive difference. And you can't really put that down to chance. Like, that's such a big percentage difference of people suffering a lot more severe symptoms.
And mechanistically, what do we think that's a result of?
It could be a lot of things. Like, obesity obviously affects the body in a lot of different ways. It's got adverse effects on your lungs, on your heart, on like most of your organs. There's a lot a lot of it with COVID-19. It seems we have like an adverse reaction with inflammatory cytokines that are overproduced, and like we see with obesity that it leads to systemic inflammatory response. So that could have a role in why the people that are overweight are struggling so much. But I think it just affects the whole body and the whole system. And it's just a lot more, it puts your organs on a lot more stress as is, and just adding that extra stress of a viral infection, I think, is just kind of tips over the edge.
Yeah, absolutely.
So I think just being in a healthy, nutrition-wise and exercise-wise lifestyle can just help with so much things, that it's not just COVID-19. I think it's just become more popular now because of COVID-19, and it's massively affected everyone's life. But any viral disease, well, most illnesses in general will affect people with a higher BMI more than people with a healthy lifestyle. I think it's just COVID-19 has really shone a light on that. So hopefully we can get some silver lining out of this, and health promotion will be more than just, I mean, most of the time it's just pharmaceuticals and pushing kind of pills on people and, okay, do this, okay, rest. But now it might be looking more towards, okay, maybe you need to start getting exercise routine. If you can do that yourself, great. If you can't, then maybe look for some advice, look for some help off a professional. Like, if you're sick, you go to a doctor. If you struggling to get exercise routine, if you're struggling to even just get started, you need a little bit of motivation to get started off. Like, it can help out massively just having even just like a cheerleader there, someone to give you advice, and then you can take that on yourself. Go on.
No, I mean, I think that you're absolutely right in this sort of being shining the light on health and wellness, and being sort of a bit of a wake-up call. I think even if we reach a stage where vaccination's been effective, we get sort of this herd immunity to SARS-CoV-2, most experts agree that it's not going to go away. So it's always going to be there sort of in the background, like a lot of other diseases that we have in the world. And so there's always going to be that need to focus on prevention of COVID, but like you said, other diseases. And I think that it's been a horrible time, but it does sort of shine a light, and as a silver lining, increases everyone's awareness around health and wellness, and I think that's a really good thing. And like you said, the there's a lot of things with obesity that may make someone more susceptible to diseases like this. Just like we know that people with obesity are more likely to have chronic pain because the fat itself is an inflammatory driver. It drives that inflammation and just puts more pressure on all the organs of the body. So like you said, exercise and nutrition are the best things to address that obesity. And so we might see across the globe that obesity rates at least stop going up would be a good first point. But if we can see that come down, I think that is a great silver lining to this whole thing.
I think as well, it's cheaper. Like if you're trying to go the pharmaceutical route or you're trying to do it some other way, I mean, going out for a jog for 30 minutes a day, it's much cheaper than going buying pills or buying whatever you need to help. But also for governments, I mean, it's in the best interest of governments to promote this kind of healthy lifestyle because it saves money for them too, like saves money on health spending, saves money on everything really. So it makes sense for them to promote that and push that.
And it'll be interesting to see if they do.
Yeah.
And it'll be interesting to see if they do here in Japan, where everything is so slow to change. And it's actually one of the things I sort of talked about with Dr. Nick Rennick on last week's episode, is that there doesn't seem to be enough. In Japan, there seems to be this big push on their approach to preventative medicine being, a lot of medical screening, examinations, tests, and a lot of those tests being, expensive and also coming with a certain amount of risk. Whereas promotion of healthy lifestyle, activity, exercise and nutrition would, in theory, be a more economical solution to that.
I think one of the big problems now is, like, for most countries, the Olympics is a driver for that kind of change. Now in Tokyo, it's probably not going to be seen that way because a lot of people are not really happy that it's going ahead. So you won't see that after effect that you got with the London Olympics of higher.
For sure.
So, I mean, I presume they were trying to use the Olympics to drive that kind of stuff. Usually they use it to drive some kind of policy. So
yeah,
a bit of a problem now.
Yeah, it's a difficult one. It's terrible timing for a country like Japan, which really, like you said, really needs an event like the Olympics to drive awareness around activity and fitness. I guess the only hope is that if we have success from Japanese athletes, that may create a little bit more awareness, and the society and media really capitalize on that.
Yeah. So I suppose moving on to a couple other risk factors. I suppose the main ones like diabetes, many of the heart conditions and lung conditions are all can be massively affected by exercise. So even diabetes, like exercise shown to lower your blood glucose, increases the body's insulin resistance. And this just 2 hours a day of walking, 2 hours a week of walking has been shown to help with that. So even as little as that, like 30 minutes over 4 days, that's not too much. Obviously, the more you do, the better correlation there is to heart health, especially. So people that do 2 hours a week were less likely to develop and die from heart disease than people who don't. And people who exercise 4 hours a week were even more so. So you can see a strong correlation between exercise and the health benefits that you can get from.
There was a big study in 2019. I think it's Stamatakis was the author that looked at activity rates on and the effect of activity levels on all-cause mortality related to sitting. So a lot of our population now are sedentary, and it showed that even if you're sitting more than 8 hours a day, doing a certain amount of exercise can help sort of decrease the risk of all-cause mortality associated with that sedentary behaviour, and it shows that the more, I guess, that the ideal situation is you don't sit that much and you do a ton of physical activity, but it's sort of a linear progression. The more activity you do, the more that sort of offsets the amount that you sit. And I think that we'll probably see more studies coming out showing the mortality of COVID patients in relation to activity as well.
Yeah, I think problem now during the pandemic is working from home, which some people see as a good thing, some people see it as a bad thing, but for the most part, it's less movement during the day. If you're stuck at home, like you're not walking to the bus or you're not walking to the train, like just taking that little bit of activity out of your daily life. Like if you're stuck at home, you're walking from your bed to your kitchen to your desk kind of thing. It's taking that little bit of activity out of it. So I think people need to have a structured routine and find some time, just take an hour break, go for a walk outside, something like that.
Yeah, I think that's a key message. I think that anecdotally, people, a lot of people measure their steps on a smartwatch or smartphone now, and everyone's saying, I'm taking so many less steps, thousands, maybe 10,000 less steps a day just by not commuting to work and being at work and, going around from meeting to meeting, walking around the office, just not getting that. They're getting out of bed, they're putting a nice shirt on, leaving their pajama bottoms on and jumping on Zoom and then not really moving for 12 hours. So you'd assume that the time demands are relatively similar, so there should be that time to just get out and go for a walk. Now, I understand that's not the case with everyone. I mean, people at home may have more sort of family obligations that just come into that sort of lifestyle of working from home. But yeah, I think there really needs to be a push to keep people active.
Yeah, I think especially when the kids are at home can be difficult, but I mean, even trying to get them into a routine of
for sure,
just go out for a half an hour walk, just as a family, even like nowhere to go, just go for a walk around, kind of. I mean, it's something to keep the kids engaged with, I suppose, keep them off the couch for a bit. So trying to do it as a family, I think would be a good idea.
I think it's fantastic. Yeah, family-based activities sort of just increase that family bonding and spending more time together. Yeah, that's fantastic. You mentioned some of the other diseases there. Do we know that they increase the risk of mortality or symptomology with COVID?
Well, with the heart conditions, I suppose it's any kind of viral illness, just putting more stress on the heart. I mean, if it's already not running at full capacity, that bit more stress can just be the straw that breaks the camel's back, I suppose. Especially with heart disease. Any kind of extra stress on that can obviously be detrimental. And I suppose COVID does affect people so differently, as we've seen. Like, depends on your body weight, depends on your body fat, kind of thing. Depends on if you're a smoker, depends on your lifestyle, really. So if your heart is already kind of not at full capacity, then just that added stress can cause big problems. I suppose exercise, I mean, it's nothing new that exercise is good for the heart, and it can help out. So just even not just the heart, like obviously increases the muscle and makes your heart stronger, but even your muscles be able to more efficiently use oxygen. So it takes some of the stress off the heart. You don't have to pump as much blood, lower heart rate, that kind of thing. So there's many ways it can affect it. And I mean, heart is one of the most important things in your body. So you want to take care of it any way you can.
Yeah, for sure. And I know, just sort of talking with some of the doctors here, they've definitely, now this is just completely anecdotal, but they have noticed the people that have come in, have tested positive to COVID and have not really been symptomatic, have generally been more active and in better shape. And so I definitely, and I'd imagine that if we asked a lot of doctors around the world, they'd probably have a similar experience. So again, that's completely anecdotal, but I think there's definitely a link between, not only mortality, which is perhaps the most important thing that we want to look at in terms of prevention, but also symptomology. I mean, if you catch one of these diseases, you just want to be able to shake it off. And I think being in better physical condition definitely improves your chances of doing that.
Yeah, it just gives you a good foundation, I suppose, to work off, like better able to fight it off in the first place. So, um, yeah, I think, I mean, for most things, it is the best way to go. Um, but yeah, even like lung disease as well. I mean, that is probably the most obvious, because it is a respiratory illness, or respiratory viral infection. So the lung disease is really going to affect it. So if you're smoking, if you've had lung disease prior, that's just an added problem you have to face, I suppose.
I guess just moving on a little and changing tone, there has been some talk about potential danger of exercise, and in particular high intensity exercise, reducing the immune system and making one more susceptible to catching diseases such as COVID. What sort of research showing in that space?
Well, there's a few studies that came out. I think there was one in 2020 actually that came out, saying, yeah, high intensity interval training should be avoided, because there's acute negative response to exercise. So your immune system will be less effective right after exercise, and that's why they say it should be avoided. Um, Many of these studies seem to be looking at the open window theory,
Yeah.
which is that susceptibility to illness after high intensity exercise. There was a study in 2018. It was Campbell and Turner, and they were trying to kind of debunk this. So they were saying the studies those that basically started the open window theory in the 80s and 90s had flawed methodology. So they were saying that basically what those studies did was they used self-reported data from marathon runners, and they had to self-report any upper respiratory illnesses. And the fact that they used that just self-reported system instead of lab-based testing, it couldn't really be seen to be perfect. And there's a few studies that came out to say that only about 30% of self-reported URTIs can actually be positive on lab testing. So it's difficult to base your theory on something with methodology that may or may not. I mean, it could be, but it's very unlikely that all of those cases of self-reported illnesses were correct, or if it was just people that were maybe feeling something, or it wasn't actually what they thought it was. Because I mean, marathon runners, most of them aren't going to be medically educated. So maybe they just have a cough and they think, okay, yeah, that might be, or they have some kind of symptom, but maybe it's not actually what they think it is. So it's difficult to get the data on self-reported evidence, I think.
Yeah.
Sorry.
No, what I was just going to say is it's a little bit frustrating when you see that sort of study being interpreted in that way, because I think it's a dangerous sort of thing to base recommendations off. Because if you then take those findings and say to the wider public, high intensity exercise should be avoided during a pandemic, or when you're at threat of potential infection, then people will take the opposite tact and say, oh well, I shouldn't exercise then, and and what's high intensity exercise? Most people don't really understand what that even is, and that can be interpreted in many different ways. I know a lot of people come into the gym saying, I like doing high intensity interval training, and that's my version of high intensity interval training is very different from what a lot of people's is. And so, people might just take those findings of a pretty poorly designed study and run with it and say, no, it's dangerous to be active. And then we're missing out on, potential benefits of specifically related to the condition, but all the other plethora of benefits that come along with activity as well. So, I think it's good to try and debunk some of those myths where appropriate, and try and educate people properly.
Yeah, well, as you everyone has seen it's very easy to find a study to back up what you think. It's just that might be one study compared to the 50 on the other side.
Yeah, I wrote a whole book with about 430 studies just to back up what I think. It's extremely easy, much easier than you'd think. And I wish I was joking. Yeah.
So basically, what they went on to say is the better idea is something called a J-shaped curve. So basically, that means that there is a optimum level of exercise, but you don't want to go into overtraining. I mean, most people are not going to be overtrained unless you're like a professional athlete or you're really pushing yourself every day and just doing a lot of exercise. You're not going to get into an overtrained state if you're doing moderate intensity exercise. So basically, they're saying that it's good up to a point, and then once you go too far, then it'll affect your immune system negatively. But for the most part, it is beneficial and it will increase your immune system's ability to fight off infection. To that point that you're going too far. But it's the same with anything. It's the same if you're just starting out exercise. You have to be careful. Like, you don't want to go too hard, but you also don't want to do nothing. So you have to find that kind of in between.
Absolutely. Yeah, it's a completely different topic, but I wrote a post about knee pain and running a few months back. If you'd like to have a look, you can check out the Club 360 socials. But a lot of people, there's this sort of myth that running will ruin your knees. And again, it's sort of that J-shaped curve that for most people, if you're running recreationally, and recreationally in the studies that are referred to, is actually everything up to being like an elite international competitor. Your risk of knee osteoarthritis and your risk of having a knee replacement is far less than those who are completely sedentary. And it's only once you start to go into highly competitive people who are perhaps pushing themselves into higher degrees of pain. So if you sort of overload the knee and then you keep pushing through it, then over time that could perhaps contribute to osteoarthritis. But the most people sort of lay on that curve where it's better to do some rather than do nothing. And I think, like you said, it just applies to a lot of things in health and fitness, and I think just educating people on where that sort of curve lies and where people should be. And yeah, like you said, most people are not going to be overtraining, and to make sure that you're not, it's probably wise to seek some advice and seek a professional, especially if you're not used to training, because with exercise we do want to have that minimal effective dose, and we want to give people the capacity to keep improving their fitness over time. So it's important that you have the right dose. But yeah, for most people, the odds of being overtrained to the point where you do have this sort of open window phenomenon, I think is very low.
Yeah. I think as long as you're taking a gradual approach to it, gradual increase, it's fine. Just don't go from sitting down to doing 20K in one go, and you should be okay. As long as you're taking it easy and just gradually building up, then I don't think you're going to find any problems.
The next thing I want to move on to is some mental health. So there's a lot of things about COVID that can increase or anything like that, but the whole pandemic that can have an effect on mental health. And I did talk to Colin Coxall about this, our CBT practitioner, way back in episode 3. But there's a lot of worry, there's a lot of concern. People aren't able to travel, but especially people living in Tokyo and not able to travel back and see loved ones, especially if you live in a country like Australia, where you're having to quarantine for 2 weeks and making that almost unrealistic. There's that concern about illness, especially if you're in an at-risk population, and there's also a lot of financial concern. People losing jobs. There's a lot of unease about the economy, and all that can sort of feed into some mental health issues, and especially if people have pre-existing mental health concerns, then that can make all that a lot worse. one of the things that helps a lot with mental health is exercise. So yeah, I think that that's probably the next thing that we need to discuss, in the importance of exercise there.
Yeah, definitely. I think even just isolation for a lot of people. Like a lot of people do have that fear to go out and mix. I mean, I think a lot of people in Japan at the moment, during this latest state of emergency, hasn't really been too much of a problem. I think most people are out and about. But there are still people that are afraid to go out and are working from home, and maybe they're single, isolated, and it just makes a big difference. And especially when when the vaccines do roll out and we're going back to work, the anxiety at actually going back to the office could be a big thing, because it's nearly a year and a half now that maybe someone working from home. So just getting back into that work environment could be pretty stressful for people. So there is like some studies, I think 2020, Panchani et al. I probably pronounced that wrong. I'll ask Francesco at some stage. So there's a systematic review on the effect of exercise on mental health, and it was found to decrease things like depression, anxiety, PTSD symptoms, and just the social aspect of it as well. Like if you're not, if you're have that fear going outside and mixing with other people, you can still do there's many like online classes that you can do, and there was a study that found even just that social interaction online can have a big effect on your mental. Just talking to someone, getting like, because a lot of time you're on your own, so you're not talking to anyone all day. So just having that interaction with someone, even if it is through Zoom, can make a big difference to people.
For sure. Yeah. The last thing we'll sort of talk about is post-COVID recovery, I guess, and the implications of some of the lingering effects of the condition on our health and wellness. And there's this term most people have heard of long COVID. And what does that actually mean? What is long COVID, and what are some of the implications there?
Well, long COVID is obviously this new term that's come out. But many people are saying that it's not a new thing. So there is something called, I'll have to read this, myalgic encephalomyelitis. Sorry. Has been
we'll just
around,
refer to as ME from now on. Otherwise, the podcast is going to go for an hour and a half.
Not saying that again. I can also say chronic fatigue syndrome. That'll be easier.
Yeah, exactly.
But that's been around for years, and people have been suffering from that for years. So what they're saying is this is basically the same thing. It's a post-viral illness, and it's something that basically the long COVID is when the signs and symptoms of COVID-19 continue for 4 weeks or longer. It can continue for 6 months, a year. It can keep going. One of the things is chronic fatigue through physical and mental tasks. So even like you're watching TV, you start feeling really tired, or you're having to think about something in work, and you're just struggling after that, and it just keeps on going after the illness. So there, at the start with long COVID, most of the rehabilitation was looked to, like you do with most injuries or illnesses, you're just trying to gradually increase your ability and your tolerance of exercise. But this was seen to have negative effects. So you have to be careful with how much you exercise or how much load you put on yourself, cognitive load and physical load throughout the day. Because they do see regressions if you push too far. So they're saying this probably affects millions of people worldwide if you go by the incidence rates of COVID and how many people suffer from long COVID after. So it's a pretty new thing. So they're trying to really get a treatment routine that will work for most people. So your clinical practice guideline type of thing, where
Yeah.
we all can kind of be doing the same thing. We're all on the same page, and we
Yep.
know how to help these people, because initially the response and the treatment plans were not working. And
Mm.
I mean, what we all look to do in medical profession is do no harm first. So if
Mm.
treatment program is doing harm, then you need to stop and find a different way to go about it. So I think the initial response to it was not great, but
Mm.
it was such a new thing for many people that you're kind of going by trial and error first, because there's not much data out there that you can scientifically put forward a treatment plan.
Yeah, so there's not no consensus as yet
Yeah.
as to how to manage those conditions. I think that I have treated a couple of patients with ME and CFS in the past, um, and I think that's patients with these conditions, I think, often feel like the broader medical profession doesn't quite understand that, I guess, the irritability of them. And I sort of think of it because with most general health conditions, we would sort of load someone with a sufficient amount of load to get them to adapt and become, more fit and stronger. Um, but yes, you do have to be a little more careful with the loading with these individuals and be more gradual and have more rest built into programs. I thought of sort of think of it as like a tendinopathy. If we're talking musculoskeletal terms, I don't know why I keep coming back to that. Maybe I'm interested in musculoskeletal conditions. But yeah, you're comparing it to like a tendinopathy compared to a stress fracture. With a tendon issue, you can load into pain, or even at the other end, muscle issue, you can often, the latest studies have shown if you push into a bit of pain with a muscle injury, even an acute muscle tear, it's likely to respond well and adapt and become stronger. Whereas if you push into a little bit of pain with a stress fracture, it's likely to get worse. They can regress and or even just a bone stress injury, they can regress to a stress fracture. I think I sort of look at ME and CFS in that sort of way. And I'm by no means an expert, but I've had patients that I've managed for musculoskeletal issues that have actually had these as comorbidities. And it makes it very difficult. It makes our job difficult if I'm trying to get someone stronger to help with their back pain or their knee pain, but I'm limited by limitation in functional capacity and exercise tolerance. Makes it pretty hard to actually progress. So I think that if you have had COVID and you feel like you just don't have that same sort of exercise tolerance, and you may be noticing even weeks and months after the bout that your shortness of breath has increased and things like that, I definitely think it's worth seeking medical advice, because, like you said, it can regress. It can get a lot worse, and it can become, as the term chronic fatigue syndrome implies, that it can become a chronic condition and something that's difficult to deal with. So I think that's a really good point. We want to help people recover, and exercise is a great tool. It is medicine. It's our main intervention for everything we do. But the way that we apply exercise interventions to this population, it may be a little bit different. And I think that as medical professionals, as you said, there's no consensus yet, so we've still got a lot to learn. But I think for the general public, if you are suffering sort of post-COVID symptoms, I think it's definitely in your best interests to seek advice and help with that.
Yeah, I think it can be pretty frustrating for people. I think similar to like a concussion where the symptoms are lasting a long time, like you don't feel like
Concussions.
maybe you're not improving, but seeking that professional help, I think, is the most important thing, just to get some confidence in what you can do. I think it can also be frustrating for a lot of people that sometimes it can be misdiagnosed and people think, oh, it's all in your head kind of thing. Like you're fine, like you just need to push in and you're just, it might be anxiety or something like that. But yeah, just that misdiagnosis can be very frustrating for people as well, I think, when it's not fully understood.
Yeah. Cool. Well, I think we've covered a lot in that, and covered some really important points. Is there anything else that you wanted to bring up in relation to this at all?
No, I think that's pretty much all of it. There was, I mean, a lot of the early studies that were coming out were on the effect of obesity and high BMI on COVID, but there was a recent BDSM, I think came out in April 2021, and it was basically on inactivity and the effects of inactivity. So they were finding that people who were consistently inactive were at greater risk of hospitalization, admission to ICU, and death due to COVID-19. So it's not just high BMI that can be a problem. It's that sedentary lifestyle or the inactivity that can also be a problem. Obviously, a lot of that will be correlated, high BMI and low activity levels, but just to have the data that says inactivity alone is one of the big risk factors as well. So yeah, I think exercise, definitely just getting out. It doesn't have to be a lot, but just being able to do something each day can have a big effect on it.
Awesome. I think that's a great message to end on. Make sure you're getting active, everyone. And Oisin, if people want to contact you or maybe even book in a session, you're, like you said, working as a personal trainer at Club 360. You're available at both our locations. I think you alternate between both our Moto Azabu location near Roppongi Hills and our Higashi Azabu location near Tokyo Tower. So people can contact Club 360, info at club360.jp, or go to our website, club360.jp, and you can find Oisin there. And yeah, we really appreciate your time, and yeah, have a great day.
Yeah, you too. Thanks for having me.